Hello, YouTube family. I am glad that we were able to talk to you again. And this month, I'm going to talk about questions of a lot of my patients ask, are all contact lenses are created equal? Great question. I always tell my patient is more complex than what you think. As a patient, as a contact lens wearer, for you, you just take the package out from take the lens out from the package and put it in the eye. But again, the science behind this is a lot more complex. So first of all, we want to let you know contact lenses considered as a medical device. Again, just want to let you know the reason that we need a contact lens prescription is because of the fact that if it's poorly fitted, it can again cause distorted vision, discomfort, even infection, inflammation, swelling, and abrasion. So in some cases, rare cases, permanent eye tissue damage could result. So do not think lightly about a properly prescribed contact lenses. Sometimes a small defect, a small problem can lead to some permanent changes. When you look at a soft contact lenses, I'm not talking about even the more complex hard lenses or gas permeable lenses. We are talking about just the soft lenses. We look at this here. There's potentially 16 different parameters that is able to determine. Each individual lenses, there's 16 different factors that you have to calculate in order to consider that lenses is a good fit. And again, you can look at that as some of the example is important for comfort is like edge profile, thickness of the lenses, the modulus, meaning how soft and how hard the lenses is, the size of the lenses, the curvature of the lenses, those affect the comfort of the lenses. For optics, we are talking about the power of the lenses, the front surface curvature, the back surface curvature, the water content, all these are created to give you the optimal vision. And then as you're looking at how about the health factor, some of the parameter is important for the health of the patients. That is, whether they have the UV coated lenses to protect the UV light from getting into the eye. Again, the wearing schedule usually determined by how the lenses surface are being treated, and the thickness of the lenses, of course, is determined how much oxygen goes through the lenses to provide the cornea with adequate supply of oxygen. Those are for the health factor. Also, the water content. Again, as you probably know, water is a good media for oxygen permeability. So if lenses have low water content, usually meaning that they are less permeable to oxygen, more water meaning there's more oxygen permeability. And then, of course, the surface treatment, say whether they have, treatment to resist bacterial adhesions, those are all important for the health of the contact lens wearer. Now, when you look at more scientifically, when you look at a soft lenses, how many curvature do they have? You look at this here, you'll notice that there's multiple curvature. When you magnify the lenses, it's actually both the front surface and the back surface have different curvature. And the back surface, because it's is fitted on the cornea, so it's a lot more complex. They have multiple curves in order to match closely to the profile of your cornea. And that's why when you see the doctor, they have to, again, measure the profile of the cornea, and then knowing that, they were able to find the best fit for your eye. So it's kind of like, when you look at it, I hate to say that, it's kind of like going to a shoe store, but instead of fitting, just find the size 7.5, 6.5 to fit your feet. They need to measure, again, the width of your feet, also, different toe, how they, how long they are, and then find you a perfect fit. Because again, as I say, a poorly fitted contact lenses can cause permanent damage, and not only that, but also affect your daily wear comfort. So this is again more profile regarding the anatomy of a soft lenses. So after you see all this, we'll have to say that not all lenses are created equal. As you look at our office, how many different type of lenses we carry in the office at one given time. The purpose is because all those lenses have the different purpose, different optics, different design to provide not only the comfort but also the optical need as well as the health need of the patients. So rarely that two eyes is the same. We are providing the same lenses for everybody. So different lenses to fit different purpose for different type of eyes for different health requirement. So just because your eye feel good and your contact lens seems to be working doesn't mean that your eye health is good. So that's why they have a prescription expiration date. Usually the prescription expires in about a year to make sure that the patient will come back to your eye doctor to make sure that the lenses are fit correctly and the eye is still healthy. And then also another question that a lot of patients call us is, can they buy contact lenses without a prescription? The answer is no. Under the U.S. legislature, you have to have a contact lens prescription to buy any contact lenses. Even for non-prescription cosmetic use, they still need a prescription for special effect or cosmetic lenses. And then, of course, also another question is, can you use your glasses prescription to purchase contact lenses? The answer is no, because the glass prescription only tell me what is your prescription for glasses, how strong or how weak your eye is. They are not providing me the rest of the information, such as the shape of the eye, the size of your cornea, as well as what is the health need and your optical needs, special need for your contact lenses. So it's only give me part of the prescription, but not all of the contact lens prescription. I hope this clip will able to, again, give you all the information you need about contact lens prescription. And in the future, we'll talk about more complex issues such as gas permeable lenses or myopia control lenses. And have a good day, and I'll see you next month.